As the big day approaches, it's normal to feel a mix of excitement and nervousness. But how do you know labor is just around the corner? Here are 5 key signs that your baby's arrival is near, plus some tips to help you feel prepared. 1. Frequent uterine contractions. Let's talk about those contractions. About 2 days before labor begins, many women start experiencing regular uterine contractions every 5 to 7 minutes. Unlike Braxton Hicks contractions, those irregular, practice contractions that you might have felt earlier in your pregnancy. These are the real deal. Here's how to tell the difference. True labor contractions are consistent, get stronger over time, and don't go away if you change positions. For example, if you're lying down and feel contractions, getting up and moving around won't make them stop. Instead, you might feel them intensify. Some people describe these contractions as a deep, cramping pain that starts in the lower back and radiates to the front of the belly. It can feel overwhelming, but remember, it's a sign that your body is working hard to bring your baby into the world. Pro tip: timing your contractions is key. Use a contraction timer app or a simple stopwatch to track how far apart they are and how long each one lasts. This will help you know when it's time to call your healthcare provider or head to the hospital. 2. Increased urination. As your baby moves lower into your pelvis, you might feel like you're constantly running to the bathroom. This is because your baby's head is pressing against your bladder, leaving less room for it to fill up. For some mothers, this symptom can start weeks before labor begins. But if it suddenly becomes more frequent in the last few days of pregnancy, it's often a sign that your body is preparing for delivery. It might feel inconvenient, especially if you're re-waking up multiple times during the night, but try to see it as a positive sign. Frequent urination means your baby is getting into position. Make sure you stay hydrated, even if it feels counterintuitive. Dehydration can actually make contractions more painful, so keep sipping water throughout the day. 3. Intensified cramps and back pain. Cramps and back pain are pretty common during pregnancy, but they can feel noticeably stronger in the days leading up to labor. This is especially true for first-time moms who may not be used to these sensations. The cramps might feel similar to period pain, but more intense and constant. You may also notice soreness or sharp pains in your lower back or groin area. This happens because your pelvic joints and ligaments are loosening to make room for your baby to pass through during delivery. One mom described it as a deep ache that felt like my hips were stretching. And in a way, that's exactly what's happening. To cope with the discomfort, consider using a heating pad on your lower back to help ease the soreness. Gentle stretches or prenatal yoga can also provide relief by loosening tight muscles and promoting relaxation. If the pain becomes too intense, don't hesitate to contact your doctor or midwife for guidance. They can assess whether what you're experiencing is normal or if it is time to head to the hospital. 4. Water breaking. We've all seen dramatic water breaking moments in movies where a pregnant woman suddenly has a gush of water and immediately goes into labor. While this does happen, it's not always that dramatic in real life. Here's what to expect. When your water breaks, you might feel a sudden gush or a slow, steady trickle of fluid. The fluid is actually amniotic fluid, and its release means that your baby is on the way. It's important to note that this isn't always painful. In fact, some women don't even realize their water has broken until they notice wetness in their underwear or a small puddle on the floor. If this happens to you, take a moment to observe the fluid. Is it clear or slightly pinkish? That's normal. If you notice a green or brownish color, it could indicate that your baby has passed meconium in the womb, which means you should contact your healthcare provider immediately. Call your doctor or midwife right away. They'll likely want you to come in to be checked. Avoid taking baths or using tampons, as they can introduce bacteria into the uterus after your water has broken. 5. The baby dropping lower. In the final stages of pregnancy, your baby begins moving lower into your pelvis, a process known as lightening. For first-time moms, this can happen a few weeks before labor starts. For those who've given birth before, it might happen just a few days, or even hours before delivery. How can you tell your baby has dropped? You might feel a noticeable change in the shape of your belly, with more pressure in your lower abdomen. Some women describe it as feeling like their baby is sitting in their lap. While this can make breathing a bit easier, it often increases pressure on your bladder and pelvis. You may also feel a heaviness in your lower body or experience a waddling sensation when you walk. Signs that your baby has dropped include a noticeable change in the shape of your belly, which may appear lower or flatter. You might find it easier to take deeper breaths because there's less pressure on your lungs. However, this often comes with increased pelvic pressure or discomfort as your baby settles into position. Remember, lightening doesn't necessarily mean labor is imminent, but it's a clear sign that your body is gearing up for delivery. If you've experienced any of these signs yet, share your thoughts in the comments below. And don't forget to like and subscribe for more pregnancy tips and advice. And while we're talking about pregnancy changes, have you noticed that mysterious dark line running down your belly? It's called the linea nigra, and it has some pretty interesting secrets. Click the next video to find out what it means. Plus, does it really predict if you're having a boy or a girl? Let's find out.